A proposed House bill centered around Medicaid expansion preliminary clears the Senate floor and takes a step closer to the governor's desk. NBC Montana's Michael Santaskoy shares the key notes from Thursday's session.
With 29 voting aye and 21 voting nay, House Bill 245 has been concurred in.
House Bill 245 gets the initial approval to move forward, but not before some back and forth comments for those for and against the proposed bill. Senator Gayle Lammers shared Medicaid expansion delivers benefits like health care, workforce development, and economic stability. According to the Montana Healthcare Foundation, Medicaid covers adults ages 18 to 64 with incomes up to 133% of the federal poverty level with the Bipartisan Help Act. Of the 268,000 Montanans enrolled in Medicaid last year, about 95,000 were covered through the HELP Act. As of this year, Medicaid expansion created up to 8,000 jobs and generates up to $560 million in personal income throughout Montana's economy annually. But if Medicaid expansion were to end this year, around 54,000 to 74,000 people would lose coverage.
For those of you who represent Montana's most rural communities, ask yourself this: where will your constituents go if their father has a heart attack, when their child is in a car accident, or when your wife goes into labor? Because without Medicaid expansion, many of those healthcare providers may not be there when you need them.
For those against the House bill, believe it'll be a financial burden for the state. According to the Montana Budget and Policy Center, Medicaid expansion is funded by the state and federal government. The federal government pays 90% of the costs and the state pays the other 10%. And according to the Department of Public Health and Human Services, the total administrative expenses for traditional Medicaid and Medicaid expansion last year reached over $40 million.
This is an irresponsible bill. This bill assumes the status quo. I'm looking out for individuals who are going to pay more at the grocery store, or for their own health insurance if they have private health insurance, or a multitude of other goods and services, because we are inflating our dollar, which means we are devaluing our dollar.
House Bill 245 will be referred to Senate Finance and Claims in a future meeting. We'll continue to follow this story and let you know what happens next. In Bozeman, Michael Santaskoy, NBC Montana.